yeast infection before, or if you experience multiple yeast infections, then you know just how uncomfortable and annoying they can be. So here are 11 ways to prevent yeast infections. Thrush or vaginal thrush or yeast infections are caused by a fungus known as Candida albicans. Now, Candida is it's normally found in the vaginal canal, but it's kept in balance by some of the other bacteria that are present inside the vaginal canal. But when things are out of balance, then Candida albicans gets a chance to overgrow. And so this overgrowth of yeast in the vaginal canal leads to a yeast infection, also known as thrush. Some of the symptoms of a yeast infection include itching, burning, pain when you pass urine, discomfort on intercourse, and a thick discharge that's usually white and resembles cottage cheese. Now, you may have a yeast infection without having these symptoms, and the way to definitively test for a yeast infection is to have some of that discharge sent to the laboratory and tested. But essentially, if you are having vaginal itching with the thick, cheesy, cottage cheesy-like discharge, then the chances are that you have a yeast infection.
So how can you prevent yeast infections?
Number one is to try and avoid taking broad spectrum antibiotics whenever possible. Now, this is not to say that if it's absolutely indicated that you should not be taking an antibiotic. There are definitely several infections that require an antibiotic in order to completely clear them. But we become so used to taking antibiotics even when we don't need to take them. So if you've had a common cold or the flu, these are viral infections and you really just need them to run their course and allow your body to heal. Taking an antibiotic is really not going to make the situation any better, but somehow we have just been conditioned to believe that if we take an antibiotic, we're going to get better quicker. And so if you've ever been tempted with this thought or this idea, then just remember that a study was done that showed that doctors are more likely to prescribe an antibiotic if the patient requests it. So absolutely, if you need to be on an antibiotic for whatever reason, then you should absolutely be on one. But just be mindful and be careful that you don't fall into the trap of requiring or wanting an antibiotic every time you feel a little bit under the weather. So antibiotics do kill the bad bacteria that may be causing an infection, but unfortunately, they also kill some of the good bacteria. And the vaginal canal is like a melting pot of several different bacteria and even fungi, including the fungus that can actually cause thrush. And so when you wipe out some of the good bugs that are actually keeping things in balance, it gives an opportunity for fungus to overgrow and cause the symptoms of a yeast infection. So if you can avoid it, try to avoid antibiotics unless you absolutely need them. Second is to avoid using underwear that is not cotton. So yeast actually loves a moist, damp, hot environment. And so if we are using underwear that's not breathable and that doesn't absorb moisture, then this is creating the ideal environment for yeast to flourish and to thrive. And so cotton underwear is always advisable just in general, but especially if you struggle with recurrent yeast infections, you want to switch out all your synthetic or nylon underwear to cotton underwear instead. This will allow your groin area not to become overly hot. It will also allow for the cotton to actually absorb some of the moisture instead of it just kind of sitting against your skin and creating the ideal environment for fungus. Definitely, if you are somebody who struggles with yeast infections, stick to cotton underwear. Third, you want to avoid using overly or wearing overly tight clothing. So did you know that things like tight yoga pants or tight jeans or tight pants can actually promote the growth of yeast? So if you have, in a similar way to what we said about your underwear, if you have like a hot, sweaty environment right up close to your crotch, this is going to give the yeast a fantastic environment to grow. So just try to avoid wearing clothing that's too tight for you. This will help to reduce the amount of heat that gets trapped in your groin area and will reduce your chances of sweating. So stick to loose fitting clothing, and even if you want to wear like your skinny jeans every now and then, just make sure that your clothing is fitting you properly and that it's not too tight. Next, avoid wearing wet clothing for prolonged periods of time. This is especially true if you've gone out swimming and perhaps your costume is soaking wet and it's taking some time for it to dry. Or if, let's say, you are sweating a bit and there's a bit of moisture collecting in your crotch area, you want to make sure that you're changing out wet clothing as quickly as possible. So again, this speaks to that moist, damp environment that yeast absolutely loves. So if you have been out swimming or if your clothing has become wet for whatever reason, try not to keep that clothing on for too long. You want to change out into clean, dry clothing as quickly as possible. This will help to reduce your chances of getting recurrent yeast infections. Number 5 is avoid douching. And so this applies not only to inserting like soaps and things like iodine solutions inside the vaginal tract, but it also includes like washing the vulva with harsh soaps. And even a lot of the feminine washes that are on the market can sometimes cause imbalance in the pH in the vaginal canal, and this can provide an ideal environment for yeast to thrive. So we've been conditioned to believe that we need to be using these washes and douches to promote optimal hygiene and to keep things smelling fresh and clean down there. And really, this is a myth. There's a lot of advertising and a lot of promotion of certain products that has gone into supporting this idea, but ultimately you don't need more than some water actually, and maybe a bit of mild, unscented, chemical-free and fragrance-free soap. So the idea that you need to actively be cleaning yourself inside is a myth. The vagina really cleans itself, and so it doesn't really need your help in order to do that. So perfumes and scented soaps and douches and all of that stuff is unnecessary. It disrupts the normal pH in the vagina, and this causes certain microorganisms like yeast to overgrow. So avoiding using douches and these feminine washes will certainly help you to prevent recurring yeast infections. Number 6, avoid using scented pads and panty liners. You really don't need a scent on your sanitary wear, and in fact, a lot of the scents and fragrances that are added into these sanitary products can be irritating to your skin. And once you get a little bit of inflammation or irritation on the surface of the skin, this can actually provide an environment for things like yeast to overgrow. Avoid using scented pads and panty liners in general, just because of your exposure also to things like endocrine disrupting chemicals, which are chemicals that could potentially be disrupting your hormones. But certainly if you are trying to prevent an infection like thrush or yeast infections, then you want to stay away from these scented products. You also want to be making sure that when you are using pads or panty liners, that you change them frequently, so that you avoid just keeping like a soiled, moist, wet pad up against you for long periods of time. This again will create an environment for yeast to grow, and so you want to avoid that and make sure that you're changing out your sanitary wear as frequently as you need to. Next, and this is a bit of a controversial one, but consider using a hormone-free contraceptive method. Contraceptives have been associated with the increased risk of recurring yeast infections, and that's because of the influence of these hormone-based contraceptives on our own body's hormones. Many women who use hormonal contraception will say that when they are on hormonal contraception, they get more yeast infections. And so there are some alternative birth control methods that don't involve hormones. So if you are on hormonal birth control and get recurrent yeast infections, and you're doing everything else to make sure that you don't get these infections, then consider switching to a hormone-free contraceptive method to see if that helps to reduce these infections. The next tip is also slightly controversial, but we mentioned earlier that one of the reasons why you can get a yeast infection is because of an imbalance in the microbiome, essentially in the vagina. So the bacteria and fungi that normally reside in your vagina are in a delicate balance, and when that balance gets thrown off for whatever reason, then certain organisms like fungus can overgrow. And so one thing that you may consider doing is taking a probiotic, especially a probiotic that has been formulated for women's health. And so this will typically contain microorganisms or bacteria like lactobacillus. So making sure that the population of lactobacillus is healthy and that you have a good balance of these bacteria in the vaginal canal is going to be important to try and prevent the overgrowth of yeast. And so one way that you can do that is by taking a probiotic every day. Next, make sure that you're always wiping from front to back. Whenever you are wiping yourself after you've been to the bathroom, making sure that you wipe from the front to the back is going to ensure that you reduce the risk of taking any bacteria that may be on the outside of the anal area and wiping them up into the vaginal canal. And so this will also help to make sure that you are reducing the risk of an imbalance in those bugs that are in the vaginal canal. And so this is important also to teach little girls, because this is a common reason why little girls can even get things like urinary tract infections. So making sure that you're wiping from the front to the back is going to help to prevent infections in general, including urinary tract infections, but will also help to prevent recurring yeast infections. Number 10, make sure that you dry the vulval area and the groin thoroughly after you have had a bath or a shower. So like we said earlier, yeast loves moisture, and if you have a wet, moist environment and if you haven't dried yourself thoroughly after you've had a bath, then this can create an environment for yeast to grow. And so making sure that you pat yourself dry and making sure that you're thoroughly dry after you've had a shower or a bath is also going to help to prevent that moist environment where yeast tends to overgrow. And finally, get your blood sugar under control. Yeast loves sugar. And so this is the reason why people who have diabetes are more likely to get recurrent yeast infections. But whether you have diabetes or not, it is important to make sure that you are being mindful of controlling your body's blood sugar levels, because if you are having these massive spikes in your blood sugar, even if you haven't been diagnosed with diabetes, then this could be putting you at risk for recurrent yeast infections. So if you are having recurrent yeast infections and you've never been tested for diabetes, I would suggest that you go and get your blood sugar tested. And even if you are not diabetic, you may be experiencing insulin resistance, which is almost like a pre-diabetic state. It's very important to think about how to manage and control stable blood sugar so that you're not creating that sweet environment for yeast to overgrow. And so if you are diabetic, making sure that your blood sugar levels are kept under control, being mindful of things like your diet, making sure that you're exercising, and making sure that if you are prescribed medication, that you're sticking to the regimen that your doctor has prescribed, and that you're checking your blood sugar levels frequently to make sure that you're staying within a stable, normal level. And a bonus tip here is also to make sure that you are supporting your immune system. A healthy immune system is vital in order to prevent all types of infections. But one of the reasons why you may be having recurring yeast infections is if your immune system is under stress or strain for whatever reason. And this could include infections like HIV, or whether you're taking medication that is suppressing your body's immune system. Like, for example, if you're on steroids for a long period of time. So essentially, it's important to make sure that you are supporting your body's immune system to make sure that you reduce the likelihood of these types of infections from occurring. And again, if you're having fungal infections and you've never been tested for HIV, it would be a good idea to get your status tested. Okay, so all of these tips are fantastic to prevent yeast infections, but what do you do if you already have a yeast infection? So yes, you can implement all these strategies even if you already have a yeast infection, because all of them will help you to make sure that the infection doesn't get worse, and also will help to support you while healing your yeast infection. But certainly I would recommend going on a good probiotic and going to see your doctor. If you already have a yeast infection, it is important to get treated. There are a wide variety of DIY remedies out there, and some of them may work, but some of them may not. And in fact, some of them may be straight up harmful. And so I would definitely recommend visiting your healthcare practitioner, getting assessed to make sure that you really do have a yeast infection, and then getting the appropriate treatment. There are a variety of different medications out there to treat yeast infections. There are some tablets that you can take. There's even vaginal pessaries, or like these suppositories that are inserted into the vagina, as well as creams that can be inserted and applied to the vulva on the outside. So just depending on the severity of your yeast infection, your doctor will be able to determine which is the appropriate treatment for you, and then you can go ahead and start implementing the tips to prevent these infections going forward.